Having multiple procedures done for aesthetic plastic surgery is a very common practice, but has to be approached with a lot of caution. And the reason being is the longer you have a procedure, the more risks are for complications, such as bleeding or patients getting cold or blood clots and DVTs. So what do we do to safeguard these things? First and foremost, I want to make sure a patient's healthy. I want to make sure a patient doesn't have any medical comorbidities such as heart disease, such as prior history of blood clots, such as prior history of bleeding, or morbidly obese, or active smoker. All of these things can make patients higher risk to have problems. If I'm unsure, I'll have their primary care doctor see them and make sure they're safe to have surgery. What we also do is in the operating room, we do a lot of things to promote safety. We like to keep the room temperature 70 degrees or a little bit higher to keep the patient warm. We do everything that we can to limit blood loss. My goal is to basically lose no blood at all if possible, because that is not good for your body. The other thing that we do is we avoid giving you too much fluids, and we avoid giving you any other medicines that you don't need, because the human body is a very special body and very intricate structure that has to be balanced. And if you do things to tip it into a different kind of balance, it can affect all systems. The next thing is, we try to avoid doing too much surgery. If somebody wants to have an abdominoplasty and they want to have a Brazilian butt lift and they want to have a facelift and they want to have breast implants and breast lift done, it's starting to get too long. And, unless you have multiple teams of surgeons helping, there has to be a point that we have to, talk as a surgeon and as a patient, have that appropriate relationship to limit operative time. Because at the end of all this, I want to have a wonderful result, but I also want to have a safe and healthy patient. So make sure you talk with your surgeon when you're approaching combination plastic surgery. Understand that there are limitations. It's very common to combine tummy contouring with breast contouring or tummy contouring with some arm contouring. But when you start combining too many places where a patient may really be hurting afterwards and not moving around much at all, that's when things can happen afterwards, such as a blood clot or a DVT. So all of these things need to be thought about prior to undergoing a big combination surgical procedure. Thank you.